Hi, my name is Katie, and I'm a doctoral student of nursing practice at Johns Hopkins School of Nursing, and a certified diabetes education and care specialist currently working in Baltimore City. As a nurse, I often see patients who struggle to access food, let alone nutrient-dense food that supports the management of their health condition. Adults who experience food insecurity are 2 to 3 times more likely to have type 2 diabetes per the CDC. So this brings me to ask a few questions. First, how common is food insecurity? Who does it impact and where? Food insecurity is a global health issue impacting minorities and those with lower income disproportionately. It also serves as a barrier to reaching the United Nations sustainability goals of 2030, such as ending world hunger and to promote good health and well-being. Moderate to severe food insecurity, which is defined as not having regular access to adequate food, in 2023 was estimated to impact 28.9% of the global population and 13.5% of the U.S. population. Black, non-Hispanic households have the highest percent of food insecurity at 23.3% compared to 9.9% for white households. We know that food insecurity doesn't always mean someone goes without food, but it impacts the quantity and quality of food consumed. Households that are food insecure and low income spend less money on food, and the food that they purchase has a lower nutritional quality. Fresh, nutritious food can be harder to find depending on the social and economic factors, such as the neighborhood you live in or disposable income one has. And fresh, nutritious food also tends to be more expensive. The price of food to establish a healthy diet has increased globally, leading consumers to buy more prepackaged food. How does food insecurity impact one's risk for diabetes and diabetes outcomes? We mentioned that a consequence of food insecurity is buying more prepackaged food, which tends to be processed. Increased consumption of ultra-processed foods has a significant impact on the risk of obesity, diabetes, hypertension, dyslipidemia, cardiovascular disease, and all-cause mortality. The development of type 2 diabetes is influenced by the interconnection of multiple factors. Individual, social, behavioral, and environmental factors can impact dietary intake and nutrition. Eating patterns can influence weight, insulin resistance, blood pressure, and lipid levels. Together, values outside the normal range can increase the risk for type 2 diabetes. In those who already have diabetes, we know that food insecurity is associated with worse glycemic control, measured by labile blood sugars, higher incidence of hyperglycemia, which is tied to hemoglobin A1C. A1C is directly correlated with the risk for many diabetes complications, and can lead to hypoglycemia, which can lead to more acute complications. In older adults, we see more ED visits, hospitalizations, and poor glucose management. Overall, food insecurity is associated with greater healthcare expenditure, such as outpatient visits and hospitalizations. It can also lead to competing demands, where individuals choose between paying for necessities such as healthcare costs, transportation, and food. What is our role as nurses or healthcare professionals beyond our individual patient? The American Nurse Association Code of Ethics states that health is a fundamental human right, which includes access to care, basic sanitation, health education, and food security. As nurses, we should promote, advocate for, and protect the right, health, and safety of the patient. This also means we're advocating for change on a population level. So we want to advocate for the creation of a system that supports healthy food choices, instead of a system that ultimately supports inequities in access to food and healthcare.
What can we learn from policies around the globe? We have learned that nutrition-targeted health taxes, such as targeting sugar-sweetened beverages, have shown positive effects on health outcomes. Sugar-sweetened beverages contribute to excess sugar, calories, and are a non-essential component of the diet. They are strongly linked to obesity and nutrition-related disorders such as diabetes. Currently, taxation on sugar-sweetened beverages covers 57% of the world population, and many countries are expanding policies to tax ultra-processed foods. It's important to recognize that any health tax needs to be considered in the context of the environment it is being implemented in. Other policies and interventions that help shift the social norm towards healthier dietary choices must also be incorporated.
Examples include labeling policies or regulations on marketing.
As of February 2023, 53 countries, including Mexico and Chile, have policies regarding front-of-package labels that help consumers identify nutrition information about the product and encourage healthier food behaviors. Marketing regulations can help address misleading health information for products such as commercial milk formula or toddler milks, which can have sugar content equivalent to sugar-sweetened beverages.
What should we know about current policies or programs in the United States? In the U.S., the Supplemental Nutrition Assistance Program, or SNAP, served 42.1 million participants in 2023. This program provides monthly benefits to low-income households to buy food. Another program to be aware of is the Expanded Food and Nutrition Education Program, funded by USDA and National Institute of Food and Agriculture, which targets low-income populations and supports nutritional health, food safety, and improves food security. Both programs are administered by the USDA and reauthorized about every 5 years by the Farm Bill. The Farm Bill in 2018 increased funding for grants to promote healthy eating.
The Farm Bill also has global impacts as it determines how the U.S. provides emergency nutrition assistance and supports development of infrastructure and sustainability practices in other countries. So it is renewed every 5 or so years. It received a 1-year extension last year. However, it just expired on September 30th, 2024, and has not been re-signed yet.
Many programs are still operating as of now, but several programs could lose funding. This serves as a call to action for nurses and healthcare professionals to contact Congress regarding the importance of enacting a strong farm bill. Are there current local programs that directly increase access to food for those with diabetes? Yes, I want to mention 2 programs that aim to address food insecurity by delivering whole foods and some prepared meals. One example is Hunger Care Coalition in southern Wisconsin, which delivers diabetes and heart health conscious food with targeted recipes and educational fact sheets. In Baltimore, Maryland, Movable Feast requires a prescription from your healthcare provider and connects you to medical nutrition therapy with a registered dietitian while delivering food to your home. These are 2 examples where I think nutrition meets clinical medicine and aims to address social determinant of health with a targeted intervention.
I highly encourage you to check out what programs may be available in your state or county and work with your local representatives to help secure funding for these important programs.
So what is the big takeaway from our discussion today? I think one of the most important things is understanding that food insecurity doesn't always mean that someone goes without food, and knowing that there is a link between inadequate nutrition and not only the risk for diseases such as diabetes, but also the impact on outcomes from those chronic diseases. I think it's also important as nurses to recognize how policies can influence the structure of the health system that we are a part of. Thank you so much for taking the time to listen today. I encourage you to research some of the policies and topics that we discussed further. Additionally, look into some programs that are more local to you, and reach out to your local representatives to ensure that there is continued access. Till next time.